Welcome to Designing Healthcare That Cares, the show where we explore how to build healthcare systems where people and performance thrive. I'm your host, Dr. Laura Sutton, a physician, coach, and healthcare leader who believes that human flourishing and organizational excellence go hand in hand. Each week, I talk with leaders, change makers, and innovators about how to shift culture, lead with purpose, and tackle the root causes of burnout. Because when healthcare works for the people in it, everyone wins. Welcome to the Designing Healthcare That Cares podcast. I'm so excited to have our guest, Dr. Tracy Asamoah. We'll hear a little bit about her. So Dr. Tracy Asamoah is a physician, a leadership coach, and consultant who helps physician and healthcare leaders grow into sustainable, human-centered leadership. With more than 20 years of experience as a psychiatrist, she brings a neuroscience-informed, whole-person approach to coaching. She partners with leaders navigating transitions, complex organizational challenges, and periods of change. Dr. Asamoah is a professional certified coach through the International Coaching Federation and a certified narrative coach. She has coached deans, department chairs, medical directors, and physicians across academic medicine and healthcare organizations nationwide. She earned her medical degree at UCSF and completed her psychiatry residency and child and adolescent fellowship at UCLA. Welcome to the podcast. So good to talk to you.
Thank you. I'm excited to chat with you today.
Yeah. We've had a lot of conversations, like we were saying before we hit record, over pancakes, a lot of breakfast conversations and just shared interests. And so I'm curious, share with our listeners how you got started looking at first into coaching and then really focusing on leadership and academic medicine. There are really not, at least from what I can see, not a whole lot of physicians that specifically coach in the academic space. And so, yeah, share with us your journey and how you got to where you are now.
Yeah, absolutely. Well, I initially started thinking about coaching pretty early in my career, actually. I think the year after I completed fellowship, I had just started a new faculty position and was diagnosed with multiple sclerosis. And at that time, realized that my career may look different later in life. And so I went on with life after that. And maybe 10 or so years ago, started thinking that if I end up having enough with having an autoimmune disorder that makes it challenging to practice clinical medicine the way I want to, I wanted to be proactive about thinking about other things that I could do. And so I discovered coaching at that point and just started exploring it and thinking about, if this is something that I'm going to do, what would it look like to transition into that career? And so coaching was really just another way that I could stay in a helper profession, but maybe in a way that was a little different than clinical. I liked the flexibility. I liked the way that I could shape what I would do as a coach, but still really wanted to stay present in healthcare to have an impact. If it wasn't direct patient care, I wanted to have impact and support those who were doing direct patient care. I trained as a leadership coach, not really thinking that intentionally about why leadership coaching. It was just the program that I found that I really liked. But what I think ended up being the thing that kind of coalesced and drew me to leadership coaching was when I was an early career physician doing leadership positions. Because if you're a doc, at some point, in some way, shape, or form, we all are leaders. Even if we're not formal leaders, we lead a team, or we lead, even as residents, you may lead a team with medical students and an intern, or as a fellow, or early career, you're working on a unit or you're working in a clinic. And so I was finding myself in these leadership positions, and at the time didn't realize I really had no idea what a leader would do. I was just like, well, I'm just going to work really hard and see my patients and run the unit really well, or run rounds really well, or whatever the position was. I was just going to work really hard and do my best, and didn't understand that the things that felt frustrating were things that I just didn't know to do well as a leader. And so as I trained as a leadership coach, and honestly, when I first started training as a coach, I was like, oh, I'm just going to be a physician coach. I want to support physicians and help them kind of understand what they wanted to do and have life not feel so overwhelming. As I started working with different physicians, I noticed that the ones that, for whatever reason, came to me were physician leaders. I was also coaching leaders in other non-medical academic settings, deans at colleges or directors at colleges, and really started to understand that kind of across academic medicine, healthcare organizations, higher education, there are these leaders who didn't have really any guidance or training about what it was to be a leader. They were identified in their careers because they were high achieving, really hardworking. They did their work really well. They were really excellent technically as clinicians, sometimes in non-medical positions as faculty, and at someone kind of ushered them down the leadership pathway or identified them for a leadership position, or the person themselves saw an opportunity and stepped into it, but often didn't have the kind of self-concept of what am I going to do as a leader? Who am I going to be? What is it going to look like? And really struggle. And so understanding, how do I understand my strengths? What are my values? How do I leverage those? And how can I do that as a leader became something that came up over and over again as I was coaching different individuals. And so I started connecting my own experiences and what I didn't receive and what I didn't understand and how frustrating that felt and how discouraging that felt, and just really felt connected and really empathize with these leaders that I was working with. I also felt really interested and curious about how leaders experience change, how they experience change themselves, how they guided their teams through change, what that looked like, how they understood it. So being a coach that really looks for leaders experiencing some sort of change, either personally, professionally, it could be individually, organizationally, is something else that I've been really curious and explored a lot with leaders.
Yeah. Thanks for sharing all that.
Yeah.
So much I want to go back to, because I feel like I could talk with you about physician leadership all day long. So I want to go back to your diagnosis of multiple sclerosis. And it makes me realize that, first of all, how hard is it being a physician just without a chronic disease, and then receiving a diagnosis, this realization that full-time clinical medicine may not be the right path for you at some point in your journey. And so looking for other areas to continue to give back and serve the medical community, which again, then serves their patients, right? And so that just hit me as you were talking about it, is how much stress do we put on our physicians that don't have a chronic disease, and then realizing that having a chronic disease is going to make it really, or may make it really challenging for you at some point to practice medicine full time.
Yeah. I feel really fortunate that I early on thought about the fact that the things that would be required of me throughout my career as a clinically practicing physician may be at odds with what I was able to do well. And so I was able to find something that I could do differently. But I've just been coaching and not doing clinical medicine for like 2 years. So it was really kind of a long journey of me rethinking my identity as a physician, right? Which is, I think, what happens with a lot of physicians is we understand our identities as physicians to look a certain way, to this never-ending, bottomless dedication, self-sacrifice, striving for this almost unattainable level of excellence, and just pushing, putting everybody first, putting ourselves last, ignoring what our brains and our emotions and our bodies are telling us, and just plowing through. And being diagnosed so early in my career, for a while, I was doing what we all do as physicians, but I had also the opportunity to think about what will allow me to have a career that's actually sustainable, what will give me longevity, what will allow me to define that and not kind of be forced into a corner because I couldn't do something the way I wanted to do it anymore, but maybe doing it in a way that allowed me to build and create a different way of using my skills and leveraging what I could do well intentionally, and not just kind of reactively like, oh, well, I guess I can't practice medicine anymore because this has happened, or, I don't have the endurance anymore, or I don't have the focus anymore. But a lot of it was reevaluating my own identity as a physician and where I could have impact and where I felt like I could add value, and coming to terms with what medicine asks of us, and knowing that we're still not in a place that it's not easy, but sometimes not an option to give less. And the option really seems kind of impossible to give less or do less. And often the opposite is true. And realizing that that might not be something that would best serve me or best serve my patients. And so that I might have to do it a different way.
Yeah. Yeah. I know this is a yes question, but what type of support? Because that's a huge identity shift and a huge transition for
Yeah.
you to start to step back from full-time clinical practice and then step away from it. What type of support did you have during that transition for yourself?
Yeah. My family and friends are great. My husband, who's also a physician, who was actually the first person who thought that I had MS. So he was an ER resident. He did an MD PhD. So when he finally finished all of the grad school and medical school and started residency, I was actually starting a faculty position at the same hospital. And when I started having symptoms and described the symptoms to him, he was like, oh, that sounds like MS, the furthest thing from my mind.
Yeah.
And from the moment that we learned that that was the case, he's just been super supportive. My mom lives nearby and we have 2 kids, and she's been supportive helping with my kids. I've got a great network of friends that have known my journey, have been with me. And I think that has probably been the game changer, is that I've always had people who've been supportive, didn't question my experience, have supported all of my decisions. And I can't imagine having been able to go through this without that. And getting to the point of feeling secure in the decisions I've made without people supporting it and not questioning it, or not saying, oh, well, not being disappointed or not expressing that, well, how are you going to be a doctor if you're not doing this or if you're not doing that?
Yeah. Yeah. That's awesome. Thanks for sharing. It's interesting. It's like, well, if I don't have patients, am I a doctor? I definitely share in that as I've transitioned my own life away from full-time clinical practice and getting more in administration, and then leaving my corporate role, starting my business, moving in and out of clinical practice. I'm not quite sure where I am these days. It's tough. It's tough. And it sounds like, again, that transition and that shift for you, as you talk about coaching others through change and through their own transitions, it sounds like has really informed how you coach and how you connect with physicians that are dealing with whatever transitions they're dealing with.
Yeah, absolutely. And also understanding that it's not that I've gotten to some definitive point that I'm like, well, I've clearly left this identity and I've transitioned into this new one, and there's no questions. The questions of sometimes the thoughts about, if you would have asked me 25 years ago where I would be at this point in my career and what I would be doing and what impact I wanted to have, this is not what I would have described. And so it's also that continual self-reflection about what are my actual values and how do my values show up in what I'm actually doing right now? What do I understand my purpose to be? How is that showing up? What changes can I make that will continue to align with that, but will also hold what's happening in the present in perspective too? And being really comfortable with pivoting and changing and saying things differently and being accepting of things being different than I thought they were going to be, and realizing that, and everything that I've gone through so far, it's worked out in a way that I've been able to figure it out in a way that I'm here today. I've found things that I enjoy doing. I've transitioned into this kind of second phase of my career, and it's working out in a way that has brought me lots of fulfillment. And so I keep telling myself every time I come up against one of those challenges or something that isn't quite going the way I want it to, that, you know what, you're going to be at a point down the road where you'll be able to look back and say, you figured it out. It worked out. You know, you'll get to that point.
Yeah. Yeah. I have this sign, probably can't see it from here, but the sign on my desk, I think it's Marie Forleo, is everything is figure outable. Yeah.
Yes,
Yeah.
absolutely.
One of my favorite. Yeah. And so what I hear in what you're saying is a lot of faith and confidence in yourself, and also being comfortable with uncertainty, which is not easy.
Yeah. Yeah. Being comfortable with uncertainty, sometimes just realizing that in some seasons, being stuck may actually be the point. Like, it may not always be that the next action is figuring out what should I do differently or where should I go. It may just be like there is something important about just being still and being in place and just searching for the wisdom there. and not figuring out like I always have to be in figured out mode. Sometimes it's just acceptance and listening in deeply and understanding mode and letting what needs to occur next emerge. And so sometimes with clients, it is just giving them space and the opportunity and permission just to say, and maybe you can just be where you are right now. Like, is that okay? And also, even in that space saying, and there's always options. There's always something different that you can do. There's always a different way you can see a situation, a different direction that you can go. You might not like all of the options, but there's rarely a time that an option doesn't exist. And so just the freedom to say, I can stay in place, and there are options that maybe I don't see, and maybe, not all of the options are equally desirable, but I have options. And so even just having that knowledge can be really helpful.
Yeah. Yeah. I want to go back to talking specifically about physician leaders. And I'm curious, what are your perspectives on why physicians, and I have struggled with this too, and it sounds like you did as well, why we as physicians struggle in leadership roles?
Yeah. A couple of things. I think our ability to establish firm boundaries is trained out of us. When you're training from the time, honestly, from undergrad, and you're declared, I'm going to do this pre-med pathway, and all the way up through completing your residency or fellowship and you're starting your career, you're kind of taught to chip away at your boundaries and just give yourself in an unlimited capacity. And so one of the things that I often explore with leaders is, how are you stepping back to see what your capacity is, what's sustainable, what your needs are, what your boundaries are, where can you say no? How do you even recognize when you need to say no? So I think that's one thing. Another thing is becoming an excellent clinician or researcher or teacher, like being excellent before you're in that formal leadership position really comes from focusing on, what am I doing? How am I developing? When something happens, how am I learning from it? And when you become a leader, that shifts to, actually, my job is to now support and develop these other people. Like, a big part of leadership is leading others, developing others. And so in what ways can I do things that aren't focused on just how am I showing up and how am I leading and working my role, but how am I developing others to do the same? Because it becomes less, as a leader who might also be doing some of these other things, it becomes less about how am I looking good and excellent to how are they looking good and excellent, and how am I facilitating that? And writing that balance, because you may be a leader as a physician, not maybe, almost always, you're leading from an administrative standpoint. So that's all of kind of the business and the financial stuff and leading and staff and all that. And also seeing your own patients, and maybe also doing research, and maybe also teaching. And then you're going back and forth between, I need to develop myself and I need to be able to show up in a certain way. And then sometimes I need to take the spotlight off of myself and look at these other people and make sure I'm giving them the opportunities to do so. And that means understanding communication in a very different way, understanding how you manage your emotions and make space for others' emotions in a different way. And we're just not taught any of that stuff. And I might be dating myself, because I am hearing slowly that some of these things are being built into training programs. And so at least there's recognition that we need to be teaching our training healthcare providers how to also be leaders and what's different about that. But most of the leaders that I coach are kind of around my age group, close enough that most of them didn't get that sort of training. And that is a really hard shift for a lot.
Yeah. I really identify with what you said earlier about being a new leader. And you didn't say it this exact way, but this was my experience. I struggled mightily with everything. I mean, I was getting my MBA at the same time, which I thought, oh yeah, this is going to teach me what I need to know. And it really set me on a great path, learning about financials and negotiation and management and all of these things. At the same time, what you said, I just want to go back and highlight that the way that we're trained as physicians almost is in direct conflict with the way that leaders are trained or the way that the skills that we need to have as leaders. So looking after our team, making sure we're asking for help. So delegation is something that I see a lot of my physician clients struggle with, my physician leader clients. So as we're trained, I love that you said we chip away at our boundaries, and the more they get chipped away, the harder it is to bring them back.
Yeah.
And I struggled so mightily as a new physician leader. And again, I see this in a lot of my physician clients. I thought I was the problem. I thought there was something wrong with me. Am I not cut out for this? They think that I have potential to do a good job, but I can't even lead this team or manage this team or get this initiative to completion. And so I just want to highlight that if you're listening to this as a clinician who's leading, and like you said, Tracy, all clinicians are leaders in some way, and you're feeling like you're not doing a great job, it is not you. It's the lack of sufficient training that clinician leaders get. And like you said, I see that shifting a little bit too, probably not enough, but I'm starting to see more recognition that if we need physicians to be leading, and if we want them to lead effectively, we have to give them the skills and the tools to do so.
Yeah. And I want to reiterate what you said for the leaders who are listening that find themselves struggling, feeling like, I don't know if I'm cut out for this, that it isn't just that we aren't given the training to lead well. The way that medicine training is structured in healthcare organizations, especially academic medicine, is actually counterproductive to being a good leader. It's very competitive. You're often competing for a limited number of resources, whether they're financial or recognition or opportunities to do things. And that is in direct conflict to the mindset that you want to have when you're leading people, where you're being very generous with how you share resources and who gets recognition for this initiative. Well, it could be you because you're the chief of the division, but it may also be a junior faculty who's really trying to grow in their own leadership. Sometimes the things that we're trained to do, and in all ways, really important to be able to get ourselves recognized, to get to the places that we want to go. Often as leaders, we have to pull back from, or we have to do in a different way. And it's hard to know how to do that. I think it also can bring feelings of like shame and guilt when we feel like we're not representing ourselves in a way that is consistent with who we know ourselves to be. But then we feel like we aren't supporting our team in a way that they need to be supported, and figuring out how to navigate that in a system that doesn't always really support leading well. And so then also contending with that.
Yeah. And that balance between administrative and clinical roles. I mean, I struggled with that. It sounds like you did as well, and a lot of your clients. And what you're seeing is pushback from patients like, well, what do you mean you're not going to be here for me every day? Or who am I going to see if I get sick? And do they think we're out just playing golf or whatever? Pushback from our colleagues, whether that's outward conflict or sometimes passive aggressive, like, why do I have to take care of these patients when they're gone? Even if we're lucky enough to have our clinical load rebalanced in some way, a lot of my clients say, I still feel like I'm working full-time clinical, and then I have this either full-time or half-time role on the side, this administrative role. And so it can be like working two full-time jobs.
Absolutely. And you said something that I think is really interesting. Something I coach a lot of clients around is a lot of leaders, especially earlier in their careers, find themselves in a position that the folks who are once their peers, their colleagues, are now part of a team that they're leading, which can cause all sorts of challenging dynamics and conflicts. So when you're now the one making the schedule, or now maybe you're the one negotiating contracts and financial decisions that affect your team, or that you're hearing about things that are happening, changes in resources, changes in staffing, all of kind of the politics that happen in healthcare. You're hearing about stuff, but now you can't really share the whole story with people that you used to talk more openly with. It can be really hard. It can really change relationships with people who you felt like you were part of the team, and now you're set apart from that feeling of collegiality. And also just this feeling of loneliness. Like I used to have all these people to talk to about what was tough, and I can't talk to, I don't feel comfortable talking to the people I used to talk to. I'm not quite sure who I should be reaching out to. And so finding people in other departments or people, sometimes with leaders say, who are people that you're meeting at meetings or conferences who are doing the same type of leadership that you're doing that you can make connections with, just so that you can start having, a community and a network that you can talk about the things that are challenging and tough, especially when the people that you used to have those conversations with aren't a great option for whatever reason.
Yeah, I experienced that a ton. And it's the phrase, it's lonely at the top, right? And it can feel isolating at times. And so I appreciate you highlighting that. That's something that I get that from my clients as well.
Yeah.
Yeah. If we think about it, looking at the physician leader standpoint, what can organizations do to help foster better development and better training for their physician leaders?
Yeah. The one thing that I'm seeing more organizations do is create pathways for development. Some of the organizations that I've been coaching with have coaching as part of a larger leadership development initiative where they're recognizing that there are a certain set of skills that, especially people who've been clinically trained, and this is nursing, physicians, could be physical therapy, occupational therapy, people who are clinically trained who now find themselves in leadership roles. There are skills that they just didn't have the opportunity to be exposed to that organizations can provide. I think the ones that do it really well do include coaching because it gives those leaders space to really dig into what are the things that I need to understand differently about myself to create a leadership pathway that is sustainable, that I really feel is aligned with who I am and what I need. Organizations are in a tough spot right now. The things that I would say is give physicians more resources and give them more agency and give them more autonomy when they're leading, to understand, if they're leading a division and they understand what the faculty or the other physicians or the staff need, trust them to do that. That's often a hard ask in this current climate to be able to do that. But, really giving clinical leaders the ability to actually lead, to be able to ask for what their teams need, their divisions, their departments, their organization, be able to ask for that, give them an actual voice at the table and allow them to get the resources they need. Because it's time and time again, I hear from physicians that they're sometimes just trying to hold a team together. They don't want faculty to walk. They don't want faculty to go to other positions, whether it's a question of clinical load or a financial question or support or whatever it is, and that they're trying to advocate for these things and they're just hitting brick walls. And so for organizations to really include physicians, clinical leaders at the table when they're making decisions in a meaningful, authentic way.
Yeah, I couldn't agree more. We'll shout it from the rooftops. Yeah. It's been so wonderful to talk to you, as always. Thank you so much for being on. Is there anything else that you'd like to share with our listeners before we?
Yeah, well, first of all, thank you. This has been a wonderful conversation, and I really appreciate the opportunity to just share some thoughts with you. And I just really want to encourage anyone that's listening out there to just give yourself permission to step back and think about, what do you really need? Give your permission to ask for and take what you need. And I'm not saying what you want. You deserve that too. But I think if we can just start with getting what you need and listening to that, and then working towards, like, I can actually get some of the things I want to, but really listening to our need, asking for it, demanding it, looking for it. I think that would be a wonderful place for everybody to start.
Thank you. Where can our listeners find you?
My website, sageelementscoaching.com, or I'm also on LinkedIn.
Awesome. We'll put that in our show notes. So thank you so much for being here.
Thank you.
Thanks for listening to Designing Healthcare That Cares. If today's conversation gave you a new idea or inspired you to see things differently, share this episode with a colleague and keep the conversation going. And if you're ready to take the next step in building a thriving healthcare culture, you can find resources and ways to connect with me at drlaurasutton.com. This podcast is for educational and informational purposes only. It is not medical advice, and it should not replace care from a qualified healthcare provider. Always seek the guidance of your physician or other qualified professional for any medical questions or decisions.